when it comes to administering a medicated patch, we need to do a few checks. With the patch itself, they will come in the original packaging, so you'll have your GP instructions detailing or guiding you as to how often we can change the patch. Might be daily, might be every 2 to 3 days, sometimes they're once a week as well, aren't they? Yeah. The patch, we're going to be checking the expiry date on here, and actually that the packaging has not been tampered and it's not broken, like within the seal. For the clients, the area of skin that we're going to place the patch needs to be clean.
Yeah.
By clean, I mean free of any oily residue, such as moisturising creams and things like that. So I'd have my flannel with just some more water, and I can just freshen that area up. With patches, it's really important that we do rotate different areas of the body that the patch is placed.
Yeah.
Now, every time I place a patch on a client's skin, when I'm updating that on Birdie, within those notes, I would add a note in there as to where today I've placed that patch. It just stops any skin becoming sensitive or any skin breakdown. So just for today, I'm going to pop it onto your forearm.
Okay.
Generally, it's going to be on the back, sort of on the trunk of the body, kind of out of sight, out of mind.
Yeah.
Okay. So I'm going to open out my packaging. I'm going to reuse this in a moment, so I'm not going to throw it away just yet. I'm going to just give it a little pull through here. Now, when I remove that first side, because that's been in contact with the patch, there's also going to be residue of medication. So that, I'm just going to fold upon itself and pop it in that packaging. Okay. So I'm going to place the patch against the skin, making sure it's nice and flat with no bumps or ridges. If you can imagine there was a ridge, it's not against your skin, so we're not going to get that full dose of medication. So just to ensure it's got full contact, I'm just going to keep my hand over it. My hands are a little bit cold actually. Keep my hand over it for around 30 seconds. Now that will make the glue quite tacky, and that will cause it to stick really nicely to your skin. There we go. So that's your patch on. I would then go to the original patch and we would gently remove this. So I'm just going to pull the skin slightly taut. If somebody's skin is quite sensitive, you can also get adhesive removing wipes or sprays, and that will just kind of help lift that off as well. Okay, so I'm just folding it upon itself. Just makes it a little bit easier for me to handle, a bit safer as well, to be fair. And I'm going to pop that in here. I'm going to come back to that in just 2 moments. Now the area that I've just removed the patch, I've got my warm water with my flannel. I'm just going to give it a little bit of a wipe over, just rinse away any residue of medication. If we get any sticky, fluffy glue outlines, maybe that patch has been on a bit longer, you can get a little bit of baby oil or oil-based moisturiser, or even those wipes and sprays that I'd mentioned, just to remove that. I'm going to keep an eye on it for around 30 minutes. If there is any irritation, we'll just give the prescriber a quick call and then we'll get their advice. Okay. With the patch, when it comes to disposing, this will need to go back to the pharmacy. Although it's used, there's still going to be an element of medication within here.